All of us want to live long and healthy lives, and according to Dongui Bogam, the famous book on medicine in Korea, the average human life expectancy should be 120 years. Yet today, the average lifespan for humans is 80 years. In today's busy and complex world, we experience all kinds of stress, and lest we forget, we are also exposed to a highly polluted environment. According to Oriental medicine, physiologically, women have yin or negative energy, in contrast to men who have yang, positive energy. And therefore, women are more vulnerable to stress than men. In addition, women have menstrual cycles, and various women's diseases are related to these cycles. There is an old Korean saying that says it is more difficult to cure one woman's sickness than to cure the ailments of 10 men. This is largely due to women's menstrual cycles. Statistically, 75% of Korean women suffer from illnesses associated with middle-aged women. What is more, in Korea, uterine cancer is one of the most common cancers among women. Women's disease can be categorized into ailments associated with menstruation, the reproductive organs, pregnancy, and childbirth. Among the ailments related to menstruation are irregularity of menstrual cycles, menalgia, and problems associated with menopause. Diseases related to the reproductive organs include uterine myoma, ovarian cystoma, and vaginitis. Sterility and pregnancy toxemia are related to pregnancy, and childbirth-related diseases include inflammation, damage to the uterus during delivery, and postpartum pain. At a symposium of Oriental gynecology held on April 4, 1998, among the many clinical studies on women's disease presented, the most notable study read that day was a revolutionary study on Jwagungdan, an Oriental suppository. According to the study, Jwagungdang has been proven effective in treating various women's diseases, ranging from uterine chill, menalgia, and irregularity of menstrual cycles, to ovarian cystoma, uterine myoma, pathological frigidity, chills in the abdominal region, and sterility. The effectiveness of Jwagungdan initially spread by word of mouth, but now it is in the media spotlight. Recently, Korean women's magazines have published articles on the herbal medicine, and after the study of Jwagungdan was read at a seminar in the States, U.S. newspapers also featured articles on the medicine. Jwagungdan treats illnesses associated with the uterus effectively by cleansing the insides of the vagina and facilitating blood circulation. As a result of numerous clinical studies, the suppository is made up of various herbs ground into fine powder and mixed with honey to form a round pill. About 30 different herbal ingredients are mixed to make Jwagungdan, and these herbs help relieve stress and can therefore be used to prevent various women's illnesses. They are also effective in treating rheumatism, neuralgia, and lumbago. Just as there is an internal order governing time and space in the universe, a woman's uterus also has an internal order of menstrual cycle, pregnancy, childbirth, and menopause. Thus, it can be said that a woman's health begins with a healthy uterus. In a famous pharmacopoeia dating back to 300 AD, it was recorded that an herb was ground to form a round pill and inserted into a woman's vagina. This is where the idea for Jwagungdan was originated. Let me briefly explain how to insert the suppository. Before insertion, the pill has to be soaked in hot water for a minute or two. Distance between the vagina and the cervical region of the uterus is approximately 7 centimeters. Use your index finger to gently push the suppository into the cervical region of the uterus. The inserted suppository is then vaporized and absorbed into the endometrium, the fallopian tubes, and the ovaries, ridding them of impurities. The repetition of this process effectively helps treat a variety of women's illnesses and diseases. Just as the tide flows and ebbs according to the moon, the uterus proliferates and diminishes monthly due to hormonal changes. This is a process known as the menstrual cycle, a natural physiological phenomenon for healthy women. Yet so many women suffer from menalgia. It is statistically shown that 75% of women experience menalgia, and among them, 5% suffer such severe pain that it hinders them from carrying on their daily lives. For some women, menalgia occurs when they sit in a cold place for long hours, or they eat too much cold food. For others, they occur when proper hygiene is not maintained during their periods, when they are under extreme stress, or when they engage in strenuous activities. In other instances, women lack physical strength, or they don't have sufficient blood in their systems, having suffered a serious disease in the past. The symptoms vary from person to person, but the most common symptoms are abdominal pain, pain in the hips, and back pain. In the worst cases, indigestion, vomiting, or constipation occurs. Indeed, some women suffer pain over the entire body. To cite a clinical example, a housewife in her mid-30s who suffered from severe menalgia came to me. She had experienced severe back pains and abdominal swelling, with cramps so painful that she could not perform her daily household chores. There are basically two different ways of treating menalgia. For women whose pains are severe immediately before and at the beginning of menstruation, the pain usually subsides during menstruation. For these women, massaging the abdominal area does not help the pains go away. Rather, inserting坐宮丹during menstruation proves effective. Women who suffer from anemia and a loss of physical strength during menstruation tend to experience pain right after menstruation. And for these women, the pains normally subside by massaging the abdominal area. Taking Oriental medicine that supplements blood loss, along with坐宮丹, to help blood circulation is an effective treatment. Uterine myoma results from muscle tissues and the mucous membrane lumping together. The three different types of uterine myoma include one protruding from the outer walls of the uterus, one in the mucous membranes of the uterus, and one growing on the muscle layer of the uterus. Uterine myoma is the most common form of pelvic tumors and accounts for 20% of female illnesses in Korea. They are more common among the non-Caucasian populations. The causes of uterine myoma can be attributed to frequent miscarriages or to sluggish blood circulation in the uterus. Common symptoms of uterine myoma are severe headaches, urinary discomfort, or blackish clots of blood in the menses. Other symptoms include frequent headaches, fatigue, respiratory trouble, constipation, or insomnia. In another clinical case, a housewife in her 40s had been diagnosed with uterine myoma. and was advised to have her uterus removed by surgery. Devastated, she came to me and asked if there was an alternative treatment that could possibly cure her tumor. In Oriental medicine, it is believed that a woman's uterus is essential to a woman's beauty and health, and a treatment of flushing out the impure blood from the uterus and helping the circulation of blood and ghee, the body's natural energy flow, is recommended. In this particular patient's case, we used Jwagungdan to help flush out clots of blood from her uterus and helped her digestion by prescribing liquid herbal medicine. After a month of treatment, her condition improved significantly. Had she had her uterus removed, she would have suffered from chronic pain in her back and abdominal region. Due to these reasons, it is more desirable for the patient to seek other means of treatment before considering a hysterectomy. Uterine chill occurs when cold air reaches the uterus, disrupting blood circulation and causing many illnesses, a malady more common among Korean, Japanese, and Taiwanese women. Some symptoms of uterine chill include cold hands and feet that fall asleep easily, increased vaginal discharge, and abdominal chill. Let me cite a clinical example. A woman in her 40s came to me with all the symptoms of severe uterine chill. She had so much vaginal discharge that she had to wear panty liners continuously, and there was a strong odor that made her feel insecure and self-conscious. Moreover, her lower abdominal region was extremely cold. She complained that she always felt cold below the waist and that just before menstruation she felt especially cold, and at times would even run a high fever. She also had frequent indigestion and experienced discomfort when urinating. I gave her herbal medicine that would help her warm her abdominal region and began the uterine cleansing process with Jwagungdan. 3 days after the insertion of Jwagungdan, clots of blood and other impurities were released. After 15 days of treatment, her discharge was significantly reduced, her abdominal region warm, and her pain subsided. When she came to me a month later, I prescribed some herbal medicine that would help her body's immune system, kidneys, and spleen become stronger. As you can see from her case, the best way to prevent a uterine chill is to keep the abdominal region warm and to maintain good hygiene. A woman's womb also has the function of ridding the body of impurities. Because of this critical function, when something goes wrong in the uterus, waste is accumulated, and diseases such as menalgia, uterine myoma, and ovarian cystoma can occur. There are precautions in using Jwagungdan. If Jwagungdan stays in the body for too long, an inflammation can occur in the uterus. It can remain in the body for a maximum of 20 hours. After about 20 hours, it is important to remove it, and there should be an interval of about 4 hours between insertions. Before insertion, soak the Jwagungdan in hot water for a couple of minutes, and after insertion, tape the attached string to your thigh. Pull it out after 20 hours. The normal cycle between periods is, on average, 28 days. If something is wrong with your menstrual cycle, you may experience severe menalgia, abnormally heavy or light periods, or blackish lumps of blood in your menses. Many unmarried women tend to overlook such irregularities, but the symptoms could cause sterility or various uterus ailments. So, I urge you to see a physician just to be on the safe side. When couples cannot conceive after 2 years of trying, we can call this case sterility. There are many reasons for the inability to conceive, such as ovarian inactivity, a cervical disorder, or a fallopian tube blockage. These malfunctions can be treated through Oriental medicine to increase the chances of impregnation. And I would like to recommend to you that you see an Oriental medical doctor. I believe the freckles are due to a problem in your ovaries and uterus. When the liver is weak, the uterus cannot function properly, thus freckles come out. So, in Oriental medicine, they are called liver spots. When women are under a great deal of stress, the liver can weaken, directly affecting the uterus and causing impure blood to accumulate in clots in the uterus. This will cause freckles to appear on the face. Taking Oriental medicine to help the liver to recover along with Dwagundan to rid the uterus of the harmful blood will be most effective in your case. Keep your lower abdominal region warm. Baths help blood circulation. Stress is a major cause of many diseases. Try to have a positive outlook on life. Eat right, including foods rich in iron. Obesity is the cause of many diseases associated with middle-aged women. Try to exercise regularly. Most diseases are not hereditary. They can be prevented by taking good care of your body. It is important that you pay close attention to changes in your body, no matter how subtle they may be. There is an irrefutable and profound order that governs the universe. Every human body is a perfect universe in itself, also governed by this order. And so is a woman's womb. The powerful and beautiful sequence from conception to birth is the very force of our existence. And a woman's health is where